Historically, medical device companies have not actually seen patients and caregivers as their primary client. Their customer is the prescribing clinician. And so they designed these devices to keep the data locked up inside the device. A dad of a 4-year-old with type 1 diabetes, he was really frustrated that he and his wife had to set alarms all throughout the night to stumble down the hallway and check the screen of their son's CGM. He was able to essentially jailbreak this medical device, send the data to his Apple Watch. And thanks to being a networker, he essentially shared the recipe. Other people created other innovations. This idea that you should be able to have access to your body's data or your child's data is radical. And guess what? 10 years later, it's standard of practice.
Back to this, who the medical providers think of as their constituency. It's the only market I can think of where how you pay determines the price. Like, that's just bizarre, right? So it's Amazon that does, if you're covered by insurance, it's this. If you're not covered, it's that. If you're trying to even make that stuff transparent, some people think that's really radical. And I wonder often how we've gotten ourselves to where we are. But insulin was invented over 100 years ago. And the person who discovered it said insulin belongs to the people. And yet we continue to have people who are suffering because they can't afford their doses. It just seems to me to be just a glaring set of mismatches. But I think part of the problem is that we have a system where things are designed for the gatekeepers. They're not designed for the end user or the end patient.